Hi, in this video let's review some additional topics. So coming to CDC classification of HIV or AIDS, as you can see, based on the cell count, CD4 cell count, and based on the clinical parameters, we have the following classification. So clinical categories A, B and C, where A is asymptomatic acute HIV or with persistent generalized lymphadenopathy, that is PGL. B, you can see it's like neither A or C, it is symptomatic. And also C represents AIDS indicated conditions. So among these clinical categories, you can see various CD4 cell categories as well. So more than or equal to 500 cells per cubic millimeter in case of A1, B1 and C1. 200 to 499 cells per cubic millimeter in case of A2, B2 and C2, and less than 200 cells per cubic millimeter, which is diagnostic of AIDS in case of A3, B3 and C3, right? So just keep this classification given by CDC in mind. Okay, now moving on to the next topic, Vita Classical Shade Guide. Exactly, I think more or less the same question appeared last year November as well. So if you observe the image, we have various categorizations of these shade tabs into A, B, C and D based on the hue. So this is Vita Classical A1 to D4. So A1 to A4 represent the following hue, that is reddish brownish, whereas B1 to B4 is reddish yellowish, C1 to C4 is grayish shades, D2 to D4 they are reddish gray, right? It's even given in their official website, the Vita website. Okay, so just have an idea regarding this shade guide, which is very important. Now moving on to the next topic, vitamin, which is also an antioxidant. I'm sure you're familiar with this, vitamin E, tocopherol. So as you can see, vitamin E, tocopherol, is a naturally occurring antioxidant which is essential for reproduction in many animals, hence known as anti-sterility vitamin. Now moving on to the next topic, cephalometric landmarks which are bilateral. We have discussed in detail about these landmarks in our E classes, so you can review them. And as you can see in the image, so we have this table where you can see bilateral cephalometric landmarks. Take for example porion or orbital or gonion, right? So you can go through this table. Also you can review the video which is posted in E classes. Now coming on to SA node, sinoatrial node, pacemaker of the heart, it's located on right auricle. So as you can see, right side of the heart has two chambers, as you know, right atrium and right ventricle. Right atrium is thin walled and low pressure chamber. It has got the pacemaker known as sinoatrial node that produces cardiac impulses, and also atrioventricular node, that is the AV node that conducts the impulses to the ventricles, right? Now moving on to the next topic, Electra Complex, Oedipus complex. You might have heard of these terms. So as you can see, Electra Complex is a psychoanalytic term which is used to describe a girl's sense of competition with her mother for the affections of her father. And this Electra Complex is thought to take place during the phallic stage, that is between the ages 3 to 6 in psychosexual development. If you remember, we have various stages of development, psychosexual developmental stages like oral, anal, phallic, latent and genital. So this Electra Complex is seen in the phallic stage, that is between the ages 3 to 6 years, right? And then I'm not sure whether this is a question or whether it's related to the CDC classification, but anyways, which cell count is decreased in AIDS? As we have discussed, CD4 cell count. Okay, now CT utilizes which of the following? That was some of the keywords which I got, like so X-rays, gamma rays, etc. So obviously it is X-rays, right? So we have discussed in detail about CBCT and all in our study club as well as E classes. So you can review that for more information. So X-rays are used in CT, computerized tomography, and also as you can see in the image pertaining to CT. So it's an imaging procedure that uses special X-ray equipment to create pictures, detailed pictures or scans of areas inside the body. It is sometimes called as computerized tomography or computerized axial tomography. Some basic layman terms for you to simply understand what CT is all about. Now moving on to the next topic, Poly A tail is associated with which RNA? It's messenger RNA. So as you can see, and as the name itself indicates, poly A, which means multiple number of nucleotides. So poly A tail is a long chain of adenine nucleotides that is added to messenger RNA molecule during RNA processing to increase the stability of molecule. And the length of this residue is in between 100 to 250, as you can see in the text, which is taken from one of the reference articles. Okay, now let's move on to the next topic, which is the type of collagen which is found in dentin. So I'm sure you're quite familiar with this type 1 collagen. If you refer Orbans, it's clearly mentioned that dentin contains 35% organic matter and water and 65% inorganic material. The organic substance consists of collagenous fibrils which are embedded in the ground substance of mucopolysaccharides, namely proteoglycans and glycosaminoglycans. And type 1 collagen is a principal type of collagen which is found in dentin, right? Now moving on to the final topic in this video, apnea hypopnea index. Now, one of you mentioned in the comments, right? So what is this index all about and what are we trying to evaluate? Apnea hypopnea index, or AHI, as you can see, it represents or indicates the severity of sleep apnea. So AHI is calculated by dividing the number of apnea events by the number of hours of sleep. So the values in adults are as follows. As you can see, normal is less than 5, mild sleep apnea is 5 to 15, moderate sleep apnea is 15 to 30, whether it's 30 or more than 30, it is severe sleep apnea. So less than 5, it's considered to be normal. In case of children, we have a variation, like AHI in excess of 1 is considered abnormal given the fact that they have a different physiology and metabolism. And pediatric patients presenting with AHI of 2 or greater will often be referred for treatment, right? So this is pertaining to AHI. So these are some of the topics which I wanted to highlight in this specific video. In the coming videos, we will deal with more topics possible. And you have any more questions or you have any more keywords, you can post them in the comments below. Or if you need any specific information from these particular topics, you can let me know in the comment section. I'll update that in the description part of the video for your convenience. I hope it's clear. So wish you all the best. Love you all.